Potassium is an essential mineral that plays a crucial role in maintaining our body's vital functions. It helps regulate fluid balance, nerve signals, and muscle contractions, including the heartbeat. However, when potassium levels become too high in the blood, it can pose a serious health risk, potentially leading to conditions like acute cardiac arrest. This is why it's important to maintain a proper balance. Potassium levels are typically controlled by the kidneys, so when kidney function becomes impaired, potassium levels tend to rise, which can lead to dangerous complications. Fortunately, there are ways to effectively manage potassium levels in the body, and one of the most commonly recommended strategies is controlling the foods we consume. Many people are often unsure which foods contain high levels of potassium and which ones have lower amounts. This confusion can make it challenging to manage potassium intake effectively. Today, I'm going to break down which foods are typically high or low in potassium, making it easier for you to make informed decisions about your diet at home. In addition, although the current guidelines may not specifically mention it, it is commonly advised that heart failure patients limit their potassium intake to around 2,000 milligrams per day. This is a general guideline to help manage potassium levels and avoid potential complications. It's important to keep this recommendation in mind when planning your meals. One of the most crucial factors in managing potassium levels is the quantity of food consumed. Even foods that are low in potassium can cause potassium levels to rise if consumed in large quantities. Therefore, portion control is key to maintaining healthy potassium levels. Now, let's take a closer look at specific foods. Among the foods we commonly eat, one of the lowest in potassium content is white noodles, such as those made from white wheat flour. For example, 100 grams of white noodles contain only about 120 milligrams of potassium. This makes them a good choice for those who need to monitor their potassium intake, especially for individuals with kidney problems or heart conditions. Additionally, if you blanch the noodles in water before eating them, the potassium content decreases significantly. For example, 100 grams of dry noodles, when boiled in water, will expand to about 270 grams. The potassium content in these boiled noodles will drop to only about 14 milligrams, which is approximately 1/8 of its original potassium content. Similarly, soba noodles, which contain about 260 milligrams of potassium per 100 grams when dry, reduce to just 34 milligrams of potassium once they are boiled. Udon noodles follow a similar pattern. When boiled, one serving, 240 grams, contains only about 22 milligrams of potassium. However, not all noodles have low potassium levels. There are types of noodles with relatively high potassium content, such as those served in Chinese restaurants, specifically the noodles used in dishes like jjajangmyeon, black bean paste noodles. A typical serving of these noodles, about 120 grams, contains as much as 420 milligrams of potassium. Although some of the potassium content is lost when the noodles are boiled, they still tend to retain more potassium compared to regular noodles. Therefore, if you're aiming to manage your potassium intake, choosing thinner noodles like those used in Korean or Japanese cuisine is a better option. Let's dive deeper into the difference between brown rice and white rice when it comes to potassium content. As mentioned earlier, white rice contains only 52 milligrams of potassium per 180 gram serving, making it a much lower potassium option compared to brown rice, which packs about 171 milligrams of potassium in the same serving size. This is a significant difference, and for individuals who need to monitor their potassium intake. Especially those with kidney disease or heart failure, choosing white rice over brown rice can be an important dietary adjustment. The higher potassium content in brown rice is due to its unrefined nature. It still contains the bran and germ, which are rich in potassium and other nutrients. While brown rice is considered a healthier option due to its higher fiber content and additional nutrients like magnesium, vitamins, and antioxidants, it's not always the best choice for those on a restricted potassium diet. In such cases, white rice is often recommended as a safer alternative, as it allows individuals to better control their potassium intake. By choosing white rice, you can continue to enjoy a daily staple without worrying too much about excessive potassium, and you can balance your overall intake by including a variety of low-potassium foods in your meals. For instance, pairing white rice with lean proteins or vegetables with low potassium content will help ensure you maintain a healthy, balanced diet while managing your potassium levels. Furthermore, rice is something we eat regularly, so it's essential to be mindful of its potassium content. If you eat rice multiple times a day, these small adjustments can add up and make a significant difference in managing your potassium intake. For those looking for variety, it's also worth noting that other staple foods, like a slice of white bread, contain a similar amount of potassium as a serving of rice. A slice of white bread typically has around 52 milligrams of potassium, making it another potential option for individuals who need to monitor their potassium levels. It's important to remember, however, that the type of bread you choose matters. The slice of white bread we're referring to here is made from refined white flour without any added ingredients. If the bread is made with mixed grains, whole grains, or has added ingredients like raisins, the potassium content will naturally increase. So, when managing potassium intake, always check the ingredients and be aware of how they may affect your dietary needs. Next, let's explore mixed grains that are commonly added to rice. Among various mixed grains, Job's tears, yomu, are known for having the lowest potassium content. For example, a typical serving of rice with about 11 g of Job's tears contains only around 9 milligrams of potassium, making it an excellent option for individuals needing to monitor their potassium intake. However, while Job's tears are low in potassium, they are relatively high in protein, which can make them less suitable for individuals who need to restrict their protein intake. During periods where protein intake must be closely monitored, such as in kidney disease or heart failure, it is often recommended to exclude Job's tears from the diet to avoid exceeding protein limitations. Now, let's turn our focus to fish. Generally, fish are known to contain lower potassium levels compared to meat. For example, a 150 g portion of mackerel contains approximately 245 milligrams of potassium. In comparison, a 170 g piece of chicken breast contains about 629 milligrams of potassium, which is significantly higher. Fish like salmon, sardines, and canned tuna also tend to have lower potassium levels, making them a better option for those needing to control their potassium intake. However, octopus presents an interesting case. A 150 g serving of octopus legs contains approximately 365 milligrams of potassium, which, while slightly higher than some other fish, is still considered relatively low. Octopus is also high in protein, providing about 32.6 g of protein per 150 g serving. This makes it a valuable food choice for those following a low-protein diet, such as patients with kidney disease or heart failure. For these individuals, consuming 150 g of octopus can help meet their daily protein requirements while staying within their potassium limits, especially if their protein intake is based on their body weight. For example, a 60 kilograms person may have specific protein restrictions they need to follow. This highlights the importance of portion control when managing both protein and potassium intake. However, not all fish are low in potassium. For instance, cod and yellowtail are known to have higher potassium content compared to other fish. A 80g serving of cod or yellowtail can contain around 280 mg and 300 mg of potassium, respectively. On the other hand, canned tuna is known for its relatively lower potassium content. If you prefer fresh tuna, be aware that it contains about 225 mg of potassium per 50g serving when eaten raw. Therefore, if you need to manage your potassium intake effectively, it is better to choose canned tuna, ensuring to discard the liquid from the can before consuming, as the liquid can contain additional potassium. Lastly, let's discuss fruits, which are another food group with a wide variation in potassium content. When managing potassium intake, it is essential to carefully select fruits based on their potassium levels. Some fruits are low in potassium and can be safely consumed by those needing to limit their intake, while others contain high levels of potassium and should be eaten in moderation or avoided depending on individual dietary needs. Selecting the right fruits is an important aspect of potassium management, especially for those with kidney disease or other conditions requiring dietary restrictions. If you found this video helpful, please don't forget to subscribe, like, and leave a comment below. I'd love to hear your thoughts and any questions you might have. Stay healthy, and I'll see you in the next video with more useful tips and insights.